Hi, I'm Detroit City Councilman James Tate representing District 1, and we are now several weeks into actually feeling the impact of the coronavirus pandemic. Medical workers are on the front lines every day saving lives, and scientists are working hard to find a vaccine that will successfully combat this deadly virus. A lot is still unknown, but what we do know as we move further away from day one that the virus reached the shores of the United States is that African Americans are dying at a higher rate than any other ethnic group in the country. For instance, right here at home, African Americans make up more than 33% of all cases in Michigan and 41% of all deaths, despite only being 14% of the population. A lot of people are asking the question why, and many factors are being identified as potential causes. Joining us today will be Dr. Michelle Reed. She is the Chief Medical Officer for CNS Healthcare. She'll discuss with us how healthcare disparities within the African American community has contributed to this heartbreaking death toll and what governments and individuals can do to help close the gap. Well, Dr. Reed, thank you again for joining us today. We really appreciate your time. Not going to take a lot of it up. But I just want to read a couple of stats to you. And I'm sure you're familiar with this, but some of our folks who are watching may not be. When we look at, they did an analysis, the Associated Press, they did an analysis of the data that was collected for the deaths of COVID-19 thus far. And what they found was, of the data that was included, 42% of those who contracted COVID-19 and died from it were African Americans, while only 21% of the total population in the state of Michigan is Black. And we're going to lift another layer up, and let's go to the state of Michigan. I'm sorry, that was the United States. 21% of the United States are Black. We're going to lift up the layer of the state of Michigan, and it says as of last week, Tuesday, Black people made up 33% of the cases in Michigan and 40% of the deaths, despite being just 14% of the state's population. Peeling back just another layer with the city of Detroit. Detroit represents 7% of Michigan's population, with 20% of the state's infections and 25% of the deaths. What does that tell us about the disparity? We know this, and as I talk about the fact that people may not know the numbers themselves, but they certainly know the impact. Is coronavirus now exposing one of the open secrets that we have in this country as it relates to African Americans in healthcare?
Oh, I think absolutely. The coronavirus is a perfect laboratory for us to be looking at health disparities and how they disproportionately affect people of African American descent. I mean, when you look at the diseases that people have that would predispose them to having a worse outcome, I mean, you're looking at being on dialysis and having kidney disease, HIV/AIDS, being treated for cancer, having severe asthma, morbid obesity. All of these illnesses line right up with a propensity for a worse outcome for the disease. And these are conditions for which we continue to have health disparities. And I think, the governor's task force looking at the impact on diverse communities for this coronavirus is exactly what we need to do. One of the other problems is the data. Not all states and jurisdictions are reporting the race and ethnicity of individuals who were either tested, who got the coronavirus, or who died from COVID-19. We must push for universal data collection that would include the race and ethnicity to give a total picture of what's going on in the United States.
So let me ask you this though. So since we're now in the, hopefully we're, as Michigan is concerned and some other states, we're now getting close to that apex. Do you think that it's too late to gather that information? Because you see information from the very beginning about men and women, males and females, but the racial data, the breakdown is not as complete in some places.
That's right, and absolutely it's not too late. What I'm hearing and what I'm understanding from looking at the National Institute of Health, American Medical Association, listening to Dr. Fauci, there is a belief that the virus will come back. So they're not saying that it's exactly like the influenza virus and it will be every year like we have with the flu, but very clearly the experts are stating that this is not a one-shot deal for us, that there will be a peak or period of time when it dies down and that it will come back. So now is absolutely the time to look at what are the impacts, what resources do we need to put in place, and most importantly, what education that needs to be put in place. I get calls from family members and friends every day about something different they heard. And I basically tell them, look, if it didn't come out of Dr. Fauci's mouth, don't believe it. So we've got to get accurate data out to people and have sources. Go to the American Medical Association, the National Medical Association, Michigan Department of Health and Human Services, Center for Disease Control. Go to reputable sources for your data, but absolutely, the scientists are saying it is key to get this data to better understand this illness, because this is not the last round of it.
So, and you mentioned this in your last comments about some of the predisposed conditions, the chronic illnesses. I'm looking on a document here, long-term health conditions like diabetes, hypertension. African Americans have it at a much higher rate. But then when we start talking about the mortality and the death rate, as compared to whites, Blacks die at a much higher rate dealing with heart disease, stroke, cancer, asthma, influenza, pneumonia, diabetes, HIV/AIDS. Now the question would, some would ask, and I've got to put it out there, are Black people more predisposed to these conditions, or is this more environmental?
Oh, I think it's going to be a combination of both. When you look at the social determinants of health, these are things that are largely made by policies that are made by government and other organizations that affect the environment that we live in. Yes, people with cancer and AIDS and diabetes and asthma are at greater risk, but those people who have these diseases that are well controlled are in a better shape than if you have a disease and it's uncontrolled. So if you think about how many people in the United States may have AIDS, may have diabetes, and don't even know they have it because they don't have a primary care physician, they haven't been examined, they haven't been tested, and they're not in treatment. Those who have the illnesses and are in treatment fare much better than those with uncontrolled general medical conditions. So absolutely, it affects access to health care. Where are the doctor's offices distributed? Is there transportation to get there? Do you have the type of job that would be sensitive to you needing to leave to go to the doctor to be treated for your asthma or diabetes? Is your health insurance one that has a decent copay so you can go get your insulin for $2, or every month is your insulin $100? So there are many political and societal factors that contribute. So it's not just about the individual and their responsibility. It's about a number of factors about whether or not, number one, is the care there, but then, do you have childcare so you can go? Do you have transportation? Well, you're going to lose your job if you leave and go for a doctor's appointment. All these things are key in better controlling these chronic health conditions that disproportionately affect African Americans.
Yeah, and when we look at just another statistic here, 87 million Americans are uninsured or underinsured, many of which are individuals who are in the underserved community. We talk about African Americans and communities of color. How do we change that? We know that there's a lot of policy decisions that are being made, especially on the federal level and then even from the local level. But when you look at the individuals who are affected the most in terms of being underinsured or uninsured, these are people who are living in a situation paycheck to paycheck. As you talked about before, you have a choice to either go to the doctor's office or take a day off of work. You take a day off of work, and now there's less pay to help take care of your family. How do we change that? And maybe this is a policy question that is even bigger than this discussion here, but are there any examples anywhere that you found that we've seen change that has occurred within vulnerable populations where initially or at one point you've seen these disparities, but there have been a change as a result of either the community doing things differently and or the government?
Absolutely. At CNS Healthcare, I can tell you what was the one thing in 2014 that made the biggest help for us was the Affordable Care Act and the expansion of Medicaid. On a daily basis at our clinic, and we've been around for almost 25, 30 years, we had 2,000 people with no insurance coverage, trouble getting medication, trouble getting primary care. When that Affordable Care Act and Medicaid expansion, Healthy Michigan came to our organization, we now have less than 100 people on our census on any given day who do not have insurance. So from 2,000 people down to 100. The other thing, fully funding that mental health, Excellence in Mental Health and Substance Abuse Care Act has greatly expanded our ability to treat people who are underinsured and underinsured. So absolutely, these are two huge federal programs that need to be expanded and funded in every state to bring services. But again, at CNS Healthcare, we can track the results. We look at a 25% reduction in uncontrolled diabetes. The waist circumference is going down. 25-35% improvement in blood pressure of the people that we see. So we're seeing body mass index going down, the weight going down, the waist circumference going down, and diabetes and hypertension better controlled because of these programs. These programs work, and we have proof.
Yeah, but how do you do that? I mean, it's one thing when you have competent care, right? So you may have a service that's available to folks, but there's a lack of trust. Let's be honest with Black folks and a number of people, and rightfully so. Whether you talk about, and we'll talk about specifically right now with the healthcare system, we go all the way back in the federal government. We go all the way back to the Tuskegee experiment. We look at it, it began in 1931, but didn't get concluded, and it didn't end until it was exposed 40 years later. And then you had hundreds of people who were affected by it, some of which who died, some of which are individuals who are affected as a result generationally. How do you get beyond the lack of trust within these underserved communities of color?
Well, I think you're exactly right. The health disparities. I was recently reading a paper, it was from 2008, where the American Medical Association apologized to the National Medical Association, an organization of African-American physicians, where they refused to allow African-American physicians for many years to join the American Medical Association, which barred them from working at certain hospitals and having certain jobs. So yes, in organized medicine, we have participated in creating that disparity. And I think it's up to the government and organized medicine to work directly to have an impact and change the way we practice, to work with a more culturally competent way of providing services, and to looking at the needs of the community. As part of what we did as part of our certified community behavioral health clinic, we had to do a needs assessment. And that was one of the number one things people talked about. They didn't know where to get services. They didn't know about transportation for services, and they weren't comfortable or confident that the providers would be able to understand their situation. So I think it's in healthcare to look at what is the cultural competence of the people, are we working in a welcoming environment where we welcome all and we're friendly to all and we want everybody to come to the door? Absolutely. I think we have to hold our healthcare organizations and the government accountable for making sure that care is affordable, it's high quality, and that it's culturally competent in addressing the needs of the various communities, especially working in the diverse, underserved communities. Absolutely.
So when we look at this virus, though, this is a right now thing. We have to get people aware and understand the dangers of it, and also how to better protect themselves from a health standpoint, even outside of all those forces that they can't control, like the government, the structural racism, the environmental issues that are around them, just in terms of healthy eating, changing certain practices. How do we do that in short term? Long term, we may be able to do that, but right now, this virus is here. What are some of those things that we can do as a community amongst each other to ensure that we're improving our potential health outcomes?
Well, I think number one is the governor's stay safe, stay home order. And it's been expanded for another month till about May 1st. Being in compliance with that order is number one. Keeping your distance from other people. Stay safe, stay home. If you're not an essential worker and you don't need to be out, you only go out when you need to have groceries or pick up something from the pharmacy. If you've got to go to the doctor, and try to combine those things together so you're less out of the house. And please, 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 whenever you go out of the house, have a face mask on, have your gloves on. So these are things that we can do to protect ourselves. But you do raise interesting points about immunity and this whole concept about African-American men affected more. I've been doing some research and looking, and in some ways, women have higher immunity than men. We respond better, create more antibodies, and are able to fight off infection better. So whatever you can do to improve your immunity, and the main things are the things we all know. Getting enough sleep at night, eating a nutritious diet, and also exercise. So these are three things. And the other thing that I think impacts immunity that's really large and is concerned, use of tobacco, substance use disorders, alcohol, and drug use. These things are all draining the immunity. So I think a focus on those, getting services for people who need help, but a healthy lifestyle definitely will help prevent this. And washing hands, of course, that's the big thing.
Yeah, they talk about, I read some report that indicated that alcohol consumption or alcohol sales during the quarantine, they're up 55% in the state of Michigan alone. And we look at a number of neighborhoods, they are food deserts. So many folks only have that liquor store, party store in their neighborhood due to transportation challenges. So this is a major, major challenge for us as we move forward. You know, some would say this is an opportunity. This is one that is going to take all of us getting right behind from the top all the way across to work this out. But one of the other issues, before I let you go, we talked about masks, wearing the mask. And we know that as African-American men, we are seen differently when we wear face coverings. This is not something new. You can walk down the street, and we've seen around the country open carry. We just talked about firearms. You know, America says, you know, this is a right, a freedom of everyone to have. You see white Americans walking down the street, and we've seen it with open carry. There's not much commentary. Black males do it, and next thing you know, there's a number of police officers who are surrounding them and looking at them as suspects. Same thing happened, I believe it was in Baltimore, Philadelphia, excuse me. I saw a video of a man who was being followed by law enforcement because he had a mask on inside of a store. Do we believe that reasonably that African-American men will be treated the same way, I want to say after this period of quarantine takes place? Because look, the reality is there's going to be a lot of folks that are going to be afraid still to go outside, even when the all clear is going to be lifted, and they're going to be wearing masks. What would you tell someone who has that fear in terms of even a governmental agency and how to deal with this real fear that individuals will have regarding the post-COVID-19 quarantine situation when wearing masks?
Yes, that's a fascinating question. And again, the overt discrimination and racial profiling, I think, are real and are of a great concern in terms of this. I mean, I never thought about it that way, that you talked about the whole concept of wearing a mask and what that represents. I've been out and about and noticed in several African-American men, and you would just be amazed at the very interesting masks that they've had on. We should do a study on that, take a photo album and put it out there to look at how we express ourselves culturally. And that's what I'm saying, a lot of cultural expression with the use of the mask, and I think is very fascinating, and it seems to draw people in from what I've observed about it. You know, the masks are saying something about you, the type of mask that you're wearing and how you do it. But absolutely, I think that is a consideration that you have to think about. And it reminds me about Michael Moore's movie about the wallet in New York. You think about that. So I think we better call Michael Moore and tell him we need to do a movie on this. That was a very dramatic movie presentation. And I think we need to do more of the same. We better call Michael Moore.
Yeah, we've got to make sure that as we leave out of this quarantine situation, that, you know, we change this country as a whole, not just in terms of a response to the pandemic. And that's another fear that many have, that once we get beyond this quarantine status and pandemic aspect of it, that the funds will go to these more affluent communities as opposed to the urban communities, as we've seen in the past as well. I'm sure that that's a question that we can't answer again on this level during this conversation, but do you have any insight on any other question regarding the disparities that I may have missed? Anything that you want to impart upon the viewing audience right now who's watching?
Oh, I think absolutely what you talked about, the Small Business Administration and how it was being applied. And I saw today Congress is really looking at how do we look at small businesses, what runs this country, minority, African-American businesses, and how will they be able to sustain. You know, that was fascinating to me, talking about if you didn't already have an existing relationship with a bank, that in and of itself will be a hindrance to be able to get these loans. So I think that's most important. I think the best thing I could say to everybody is stay safe, stay home, wash our hands, wear the gloves and mask when we're out and about, and that where's hope? We are going to get out of this, that we are going to survive and thrive as a community, and that we'll take the lessons that we've learned from this situation to protect ourselves better for the next time. I think we'll be better prepared in terms of our daily going about for how we live. So stay safe, stay home, wash those hands and wear those masks and gloves. That's the best thing you can do to protect yourself.
And they're predicting that this something of this nature may now happen every 20 to 30 years at this point because of the rate that the viruses are now starting to accelerate and mutate. And I think we talked last time, you indicated that there more than likely won't be a vaccine until maybe 18 to 21 months. And I'm sure they're trying to accelerate that as well. So we are going to be dealing with this challenge for quite some time. It's just a matter of what does life look like on the other side of
yes,
this.
and we're celebrating 100 years since the last plague, the great flu epidemic from 1918 and 1920. Infected so many people and so many died. So again, these pandemics are not new. You know, you had the bubonic plague before, so there have been several of these type of plagues widespread. And I think the planning that needs to go on, we just cannot stress enough that we take out of this situation, whether it's planning for government, planning at your job, planning your home, that brought back the need to be prepared and making sure that we're ready and know what to look for the next pandemic. But yes, pandemics have been, I think the plague, the Black Death was around 1300. So absolutely, there have been multiple plagues that have affected us. And this will, I think, help us be better prepared the next time around. But yes, it is reasonable to assume that there could be another pandemic. Absolutely.
And what's interesting is when I looked up the Spanish flu, the 1918, some of the same techniques to help keep people safe, they're being used today. The social distancing, the masks, and the shutdown of a number of different businesses to keep people from, well, basically the self-isolating of individuals. So, and we should be in a better situation, better prepared in situation now as it relates to the advancement in medicine, well beyond in 1918. One last thing, I want to go back really quickly to the vaccine aspect of it. And then the culture of that is within the African American community, again, the distrust. We have to talk about that because we have a number of individuals that I know personally, and sometimes I'm a little apprehensive about it as well as an African American man. The vaccine. They're going to create a vaccine and more than likely suggest that you end up taking that vaccine. There are a number of folks who said, I'm not going to take the flu vaccine because all it is a plot to get us infected, and hearing all these different conspiracies. Again, let's go back to how do we lift up those particular layers of distrust and get people to at least be open to the idea and concept of taking these vaccines. And again, there's a lot of historical references that will give validation to the skepticism. But we have to ensure that we change some of those behaviors. How do we do that?
I think that we look to people, leaders like yourself and myself in the community. I look to organizations like the National Medical Association, an organization of African American physicians, to be working within our communities to get the word out. I think African American professionals in the community and within their professional trade organizations need to play a big role in the overall education. But we also need to be mindful when that vaccine becomes available, the insurance coverage, to make sure that it's going to be covered, that there's going to be minimal co-pays and deductibles for it, and that we have a plan rolled out to vaccinate people who are uninsured. I saw something the other day where they're saying the children who currently are in detention, they had orders not to vaccinate these children for the flu, and they are in a very tight, closed area without good ventilation. And so the illness can spread in our population relatively quickly, so that we have to be looking at what is the overall plan, where is the access to the drug, what's the cost to get it, and whether or not we're going to be making it available to everybody who needs it, in addition to dealing with the whole vaccination hesitation. But I think we have to count on African American professionals and professional organizations, the sororities, the fraternities, and the other social groups to just get out there and work together, the NAACP, Urban League, to work together to get the word out in the community and speak with one voice and a uniform platform, all the Greek organizations. I think that's what's essential.
Yeah, there's a lot of grassroots individuals that are doing a lot of great work, and they have a lot of influence in the community as well. So as we said before, it's going to take everybody to help transform this situation from what we see now to one where we have equity amongst our healthcare and not this disparity that we see amongst African Americans and others. So thank you so much for joining us again, Dr. Michelle Reed. She is the Chief Health Officer for CNS healthcare. You make sure you take care of yourself as well. Thanks for joining us.
Thank you for having me, Councilman Tate.
All right.
There's a lot of blame to go around for the health disparities that we find in this country, but finger pointing alone won't change very much. There has to be a clear plan of action put in place by those in power and who have the ability. And as individuals, we have to place our health care and our health as a priority, not just treating conditions as they arise, but exercising preventative measures as well. I don't have all the answers right now, but as an elected official in a city with a population of at least 80% African American, I commit to focusing even more closely on what I can do to help close the gap, the disparity gaps in healthcare, education, and economic outcomes, because they're all interconnected. There's no easy solution, no easy answer to this, and getting us to where we need to be is going to take time. But what I've learned is that once light is shed on a particular issue, a particular problem, it can be fixed, but only if there's a transformational undertaking that goes well beyond words. Until next time, stay safe, stay strong, and at least for now, stay home unless absolutely necessary. Thanks again for watching.